Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Uncontrollable movement of body parts, tremors, stiffness, or for that matter, difficulty with balance and coordination sound like symptoms of old age, isn't it? But what if I tell you that these are the most prominent symptoms of a progressive neurodegenerative disorder called Parkinson's disease? Now, this dangerous disease decreases the level of dopamine in the brain, which leads to movement disorders. Today in Wellness Watch, we discuss Parkinson's disease. I'm Preeti Kaur. Parkinson's disease is a condition that affects millions of people worldwide. It impacts the central nervous system, causing movement problems like tremors, stiffness, and balance issues, which can severely affect a person's quality of life. Every year, April 11th is observed as World Parkinson's Day to amplify the awareness and understanding of this disease internationally. Today, we take a closer look at what Parkinson's is and how it affects the body and why early diagnosis and treatment are so important. Here's a report by DD India's Harshita Oberoi.
Every movement we make, from a step to a mile, is controlled by the brain. But when even a small part of the brain malfunctions, it can disrupt the body's ability to move smoothly. This disruption is known as a movement disorder. Among the most common and serious of these is Parkinson's disease, a condition that gradually affects how a person walks, talks, and lives. Parkinson's is a chronic degenerative disorder of the nervous system. It strikes when dopamine-producing nerve cells in the brain begin to break down, slowly starving the body of the chemical it needs to move with control and ease. As dopamine levels drop, the signals from the brain to the muscles falter, leading to tremors, stiffness, and slowing of movement. Although Parkinson's is commonly diagnosed after the age of 60, younger adults can also fall under its shadow. The symptoms are many and they worsen as the disease progresses. Tremors, slowed movement known as bradykinesia, stiff muscles, impaired posture and balance, changes in speech and even handwriting. These aren't just inconveniences, they're daily hurdles that affect everything from walking to talking. The exact cause? Still unclear, but some risk factors are known. Age is the strongest. Most cases occur after 60. Men are more likely than women to develop the disease. Exposure to certain chemicals and genetic mutations can also increase the risk. People with Parkinson's often experience additional complications, many of which are treatable. They may include trouble thinking clearly, emotional changes and depression, difficulty swallowing and chewing, sleep disturbances. And while there's no proven way to prevent Parkinson's, research shows that regular exercise may offer some protection. Currently, there is no specific test to definitely diagnose Parkinson's disease. Doctors rely on a combination of tools such as physical and neurological exams, blood and lab tests, imaging tests like MRI, brain ultrasound, and PET scan, a specialized scan called a dopamine transporter scan, genetic testing, and the alpha-synuclein seed amplification assay, a promising new test that may detect Parkinson's before symptoms even begin. But there is hope. While there is no cure, Parkinson's can be managed. Medications help increase or mimic dopamine, easing many symptoms. Physical, speech, and occupational therapy play a key role in maintaining mobility and independence. Advanced treatments like deep brain stimulation surgery are helping patients regain control and confidence. Lifestyle changes are equally important. Exercise strengthens muscles and improves balance. A nutritious diet supports brain and body health. And small daily habits like walking or practicing yoga can slow the progression of the disease. With early diagnosis and the right treatment plan, Parkinson's doesn't have to define someone's life. Awareness, action, and support. These are the tools we need to fight back against this silent progression. Harshita Oberoi reporting for Wellness Watch, DD India.
More than 10 million people across the world are living with this disease. Also, disability and death due to Parkinson's disease are rapidly increasing. It impacts the central nervous system, causing movement problems that severely impact a person's quality of life. Although Parkinson's is the most commonly seen in old adults, it can affect people of all ages. Also, Parkinson's disease is a degenerative brain condition, meaning it causes parts of your brain to deteriorate. There is no known cure for Parkinson's, but there are many different treatment options available. Today in Wellness Watch, we try to understand these questions. What is Parkinson's disease? What causes this disorder? What are the stages of Parkinson's disease? What is idiopathic Parkinson's disease? And also, what treatment options are available in India? All right, the basic idea of the show is to acquaint you with the treatment methods that are available in India, making India a medical hub. And up on your screens, we'll have a list of hospitals which will tell us about the treatment options that are available in India. In India, Parkinson's disease treatment typically involves a combination of medication, physical therapy, and other therapies like occupational therapy and speech therapy. Also, advanced cases may benefit from surgery like deep brain stimulation. Up on your screens, we have the list of hospitals: All India Institute of Medical Sciences, Delhi; Postgraduate Institute of Medical Education and Research, Chandigarh; Safdarjung Hospital, Delhi; Ram Manohar Lohia Hospital, Delhi. All right, to also help us understand Parkinson's disease better, we are joined in by guests today. We're joined in by Dr. Achal Srivastav, Professor, Department of Neurology, AIIMS. And we're also joined in by Dr. Rajendra K. Dhamija, Professor of Neurology and Director, Institute of Human Behavior and Allied Sciences, Delhi. Thank you so much, both of you, for joining us this afternoon. Dr. Dhamija, first I would want you to explain to our viewers in very simple layman terms, what is Parkinson's disease? We have shown a detailed report telling the dangers and also how severe it can get for a person. But to begin with, what is Parkinson's disease?
So, Parkinson's disease is named after James Parkinson, who was a British doctor who was born on 11th of April 1755. That is why we celebrate April 11th as a World's Parkinson Day, to create awareness and to support the patients living with Parkinson's disease and their families, and honor their resilience, and to create a worldwide awareness about the Parkinson's disease. So, basically the Parkinson's disease is because of the deficiency of a neurochemical hormone called dopamine, which is secreted by the part of the brain called striatonigral pathway, just substantial nigra in the midbrain. So once these cells, they start dying out or they start diminishing, there is a deficiency of dopamine, which causes plethora of syndromic many symptoms, like you said, tremors, which is shaking of the body. It starts usually with the one side of the body. It is a rigidity or the tightness of the limbs, and then there is a postural balance, and of course the slowness in walking, doing everything in daily life. So TRAP means tremor, rigidity, akinesia, bradykinesia, and postural imbalance. So these four symptoms are cardinal symptoms of idiopathic Parkinson's disease. But more important is, it also resembles so many other diseases called Parkinsonism.
Yes.
So we have to differentiate between idiopathic Parkinson's disease from the Parkinsonism, and that's a big challenge for all of us.
All right, we'll talk about that ahead in the show, but I'll take that forward to Dr. Srivastav. Dr. Srivastav, deficiency of dopamine causes this disease, but then help us understand, is it always genetic?
Yes, if you ask about Parkinson's disease, the chances of it occurring because of genetics is below 45 year age. So younger age at onset is a scenario where patients are likely to have genetic kind of Parkinsonism. Otherwise, the usual age at onset in India, it is somewhere between 50 to 55. And in that age group, it is mostly idiopathic Parkinson's disease. However, young patients are more likely to have some genetic etiology behind the Parkinson's disease. The symptoms remain same. There is a difference between progression of the disease. However, it looks like as if they are same. Age at onset is that 50 to 55 year age group, whereas the genetics Parkinson's disease will have an onset below 45 year age.
All right, Dr. Dhamija, what are the stages of Parkinson's disease? Now, tremors and posture imbalance, or for that matter, balance of the body. Now, these are somewhat symptoms associated with old age, isn't it? So how does one know that it is the Parkinson's disease that has to be dealt with, or is it a regular old age symptom? When is it that a person needs to see a doctor?
Yeah, that's a very common thing to ask, whether it is because of the aging, which is a normal phenomena, or it is a disease, idiopathic Parkinson disease. So there are about 10 million people in the world who suffer from Parkinson disease, and out of those 1 million live in India. And as Dr. Srivastava rightly said, that if your age is younger than 50 or 45, the 10% of people will have a genetic basis or inherited Parkinson disease. So that's very important to know, that younger people more likely or more chances of having a familial Parkinson disease. Having said that, you know, the symptoms, the stages which you asked, the stages could be prodromal. For example, the symptoms coming early, even before the diagnosis of Parkinson's disease is made. People as early as 20 years before the diagnosis can have a loss of smell, or a constipation, or what we call REM sleep behavior disorder, when you have a vivid dreams and you move around while you're sleeping. So these are the prodromal symptoms. Then there are preclinical symptoms also, and then there's a mild early Parkinson's disease, and then there's mild to moderate, and then moderate and advanced. There are different stages, different classifications, stage 1, stage 2, stage 3, stage 4, stage 5. So it usually starts from the unilateral side. That is different from the normal aging, which will have both sides equally affected by the aging process. So those patients will have a one-sided tremors or shaking, one-sided rigidity, more of during the morning times, or sometimes they have a sleep benefit also. So one-sided weakness, one-sided slowness, one-sided tremors, one-sided stiffness. That's main difference from the normal aging process.
Right. All right, Dr. Srivastava, now one-sided symptoms is what Dr. Dhamija clarified for us. It is a progressive disorder, it is a progressive disease. Does that mean that it will always aggravate with growing years? With advancing age?
Yes, it will. It is the nature of the disease, or natural course of the disease. As you understand that it's a kind of degenerative disease. So it's a process which will keep on happening and keep on continuing. So that is why the symptoms will keep on worsening.
All right. Dr. Dhamija,
one side.
Yes, please continue, sir.
Yeah, it starts from one side, and over a period of time, you will notice the symptoms on both sides.
So that's very important. It starts on the one side, and then as the disease advances, it involves both the sides.
All right. Also, we mentioned to our viewers in the report, we showed some options available for treatment, but acquaint our viewers with how is Parkinson's disease diagnosed?
So diagnosis is mainly clinical. So it's syndromic, the presentation of the patient, as I said, unilateral symptoms starting with the one limb shaking, rigidity, postural balance, and the slowness in walking, slowness in doing activities of daily living like shaving, buttoning, things like that. It takes more time. So obviously everything becomes slow. Whether it is constipation, your gut is slow, there is a pooling of saliva in the mouth, so there is a drooling because the patient is not able to swallow because of the slowness. So everything is slow. So that is mainly the clinical diagnosis, but it is confirmed with the radiological imaging testing, as you rightly mentioned, and these tests are mainly to rule out the other Parkinsonism disorders. So it could be drug-induced Parkinsonism, it could be essential tremor, it could be other neurodegenerative conditions. They look like Parkinsonism or Parkinson disease. So the tests are done to rule out those conditions and to confirm the diagnosis of Parkinson disease.
All right, that was about diagnosis. Dr. Srivastava, how is Parkinson's disease treated? Is there a known cure for Parkinson's disease?
Your question is, can we cure Parkinson's disease? Yes, the answer is no. Okay. We can't. We can help the patients to improve a lot, and his quality of life may be improved a lot, and sometimes the patient comes back to almost normal activity, but at the same time, as per the nature of the disease, it keeps on progressing. We are talking about drugs which may be given for treating these patients, and there is other option of doing deep brain stimulation. For such drugs, so in drugs we give a drug which replaces dopamine. As we pointed out earlier, the dopamine is less in the body, and that's why the disease happens. So we give dopamine from outside. So it's a combination of levodopa plus carbidopa combination, which is given to these patients over 2 to 3 times a day. And then we notice improvement in the rigidity, we notice improvement in the slowness, we notice improvement in the tremor. So accordingly, the patient is able to perform his daily activities, and that's how it works. And there are other group of drugs like dopamine agonists, which are also given according to the requirement and according to the judgment of the treating physician. And also sometimes trihexyphenidyl is given. There is a scenario when drug stops working, or I should say in the common language, it misbehaves. Then what we do, we think of other options. The other option is doing deep brain stimulation, in which we stimulate the brain through wires, just like pacemaker is used in heart diseases. Similarly, it's a kind of pacemaker-like thing which is put in the chest wall, and it stimulates part of brain, and the wires go through the skin and then penetrate into the brain. So it helps in the symptoms, specifically in rigidity and tremor.
All right, Dr. Dhameja, can Parkinson's disease be prevented? You were telling us that even young adults can be affected by this disease. Are there any lifestyle changes that can be made? What precautions can one take to, keep himself away from Parkinson's disease as the age progresses?
So we don't know exactly the main risk factors for Parkinson's disease, and these risk factors can be managed. But having said that, I think the lifestyle, having a healthy lifestyle in terms of a nutritious diet, adequate physical exercise, aerobics, and leading a sedentary, not sedentary, very active life, that is very important. And of course, there are various theories, but the cause of Parkinson's disease in India could be something like pesticides, something like well water sometimes. So all these things are postulated. They are not confirmed, but the risk factors are mainly age and male gender, and of course to have that healthy lifestyle, a nutritious diet and exercise could be helpful in preventing Parkinson's disease.
That brings me to the next question. Why are men more prone to Parkinson's disease?
It's just that the gender more propensity or susceptibility is more in males. It's not known why, but it has been seen from various research studies that it is more common in males than females. But coming back to the treatment part, which you mentioned, and Professor Achal Srivastava again elaborated. So once we make the diagnosis, then we see whether it is affecting his functional ability, whether the patient is able to carry out his functional activities in a normal way. Once he starts having difficulty in functional activity, we start the treatment in terms of medications to replace dopamine, which is deficient in the body. After a while, the patient responds very well for first 6 to 7 years, what we call honeymoon period. When the drugs are working, the patient is happy, the doctor is happy. But once that honeymoon period is over, the drugs start a little bit having problems. The patients have got less effect. The drugs also start having side effects. Disease is also progressing, and then these complications come up, whether it is your cognition or it is postural imbalance, having falls, and neuropsychiatric symptoms. So all these symptoms come after that, and there is a motor fluctuation when the patient starts, which say for example the drug kicks in little later or works for a shorter period of time. So these are called motor fluctuation, or people can also have a little bit of dyskinesias, like very violent movements because of the drugs. So that is very important to see that complications coming up after 6 to 7 years of starting the treatment, and that is also very important to manage, and that is in the hands of skilled movement disorder neurologists.
Right. All right, Dr. Srivastava, acquaint us with what medical advancements have been made in this field. Dr. Srivastava, are you there with us? All right, I think we've lost contact with Dr. Srivastava. We'll try getting back to him again, but I'll take that question forward to Dr. Dhameja. So what medical advancements have been made in this field?
So in last decade or so, we have two types of advancement. One is the diagnostic advancement that you mentioned. Seed amplification SAA is now commercially available in United States and some European countries. It's likely to be available in India also, and we are doing in our own hospital, we are doing research on this SAA estimation for the alpha-synuclein in the body fluids, the cerebrospinal fluid, as well as the saliva and urine. So once they are available in India, they will be very easy to diagnose. That is one diagnostic, and the imaging also we have come up with a better imaging modalities. These are the diagnostic advancements. In terms of therapeutic, the treatment advancements, there are many of them. Various forms of levodopa has come up as a research, whether it is sublingual levodopa, even the subcutaneous levodopa has been commercially made available in last 1 year. These are the various forms of levodopa. As you know, there is a deficiency of dopamine, and we have to replace it from that. In addition to that, we also have device-based treatment where we can give levodopa through a tube in the stomach or through a subcutaneous method by giving apomorphine. And of course, there is a deep brain stimulation, which is a functional neurosurgery, where you put 2 wires in the brain. It's like a pacemaker in the heart, and you put a pacemaker here. We can titrate the and monitor the current, and that is very, very effective. But you have to have a right selection of the patient. So it's not that the drugs are not working, the DBS will work. So obviously, there is a subgroup of patients where we do use the DBS or deep brain stimulation, and it works very nicely, provided you select the patient rightly.
All right. Dr. Srivastav, can Parkinson's disease prove to be fatal for a patient?
Not in the early part of illness. As the disease advances, then the slowness worsens. You will find in the I will say the most advanced stages, the patient will be not moving at all. The drugs also not working at all. So in that scenario, patient develops kinds of infections and other things, not able to take food. So all those things combine, and then he can he may be in a infectious state, maybe sometimes some metabolic derangements, sodium potassium is deranged. So all those things lead to a scenario where sometimes it becomes difficult to bring the patient back.
All right. So for our guests who just joined in, today we are discussing Parkinson's disease on Wellness Watch. We are joined in by guests who are helping us understand the disease better, and they did clear many doubts, but then we'll have a quick rapid fire question round, a kind of a myth buster round for our viewers to get more clarity. I'll request brief answers from you, and that would help clear more air for our viewers. Dr. Dhamija, Parkinson's is only a motor condition, is it so?
No, it's not only a motor condition. Of course, predominantly motor symptoms are there, but lots and lots of non-motor symptoms are there, which also are equally important.
Dr. Srivastav, starting medication early for patients may cause it not to work when they are getting older. Is it so?
See, it's a controversial entity, as Dr. Dhamija pointed out, that we should start the treatment when we think that the patient is having difficulty in his daily activities. So it's a controversial thing because people have been working on that we should start treatment early. It's a point of discussion. However, the current practice is to start the treatment when the physician feels that the patient is having difficulty in his daily activities.
All right. Dr. Dhamija, a person with Parkinson's disease can suddenly become bed-bound. Is it so?
It's a chronic progressive disease. Eventually, the disease will progress, but it's not that in early stages the patient will become bed-bound. So it's very, very unlikely to have a bed-bound condition early in the course of the disease.
Dr. Srivastav, everyone with Parkinson's develops the same symptoms. True or false?
Yeah, it's not everyone will have same symptoms, although some symptoms are common, like tremor, rigidity, and slowness are common. There are other symptoms. Some people will have falls, some people will have very prominent tremor. So it's a kind of some differences are seen. However, three symptoms are common. One is slowness, the other is rigidity, and third is tremor.
All right. Dr. Dhamija, beyond drugs, nothing can help.
No, it's not true. Beyond drugs, there are modalities, and I always advocate that physical activity, physical exercise, right from the beginning at the time of diagnosis and throughout continuing, is very, very important, complementary. And of course, the device-based therapies and surgery, they're all options are in some of the patients.
Dr. Srivastav, medications work only for a few years. True or false?
Yes, of course. That is called a honeymooning period, and it works up to 7-8 years.
All right, with that, we end this discussion here. Thank you so much, both of you, for joining us and helping us understand Parkinson's disease better. We had Dr. Achal Srivastav joining us virtually. He was Professor, Department of Neurology, AIIMS. And with us in the studio, we had Dr. Rajendra K. Dhamija, Professor of Neurology and Director, Institute of Human Behavior and Allied Sciences. So after the discussion, we now know that there is no cure for Parkinson's, but we should aim to increase understanding and support for people living with this disease. This disease, a progressive neurodegenerative disorder, impacts movement and can also lead to non-motor symptoms like depression and anxiety. Raising awareness helps individuals get diagnosed and supported, and also promote research towards better treatment and eventually a cure. Remember, having Parkinson's is not a choice, but surrounding that, there are several things that one can choose. On that thought, we'll end this edition of Wellness Watch here. Thanks for watching. Bye-bye.